So here are a few important things to know when it comes to birth control and epilepsy. Not all types of birth control are contraindicated when it comes to epilepsy. There are some that can affect your anti-seizure medications. There are some that can make your epilepsy worse, but there are some that work really, really well. And because of that, it's really important to have this conversation early on with your doctor, especially with the recent decision that just came out. There are many issues with the most recent decision, but the big thing and the thing that worries me is that it is going to disproportionately affect women with chronic illness, be it epilepsy, be it other neurological condition, be it other autoimmune conditions. And the reasoning behind that is traditional birth control methods are often not as useful when it comes to this patient population. Specifically for women with epilepsy, we recommend IUDs because the hormones are not systemic and they do not interact with your medications, and they, in theory, should not make your seizures worse. With that said, an IUD is not the best decision for everyone. So please, if that is something you're considering, let your epileptologist, your seizure doctor, know, and also communicate that with your gynecologist. Not all seizure medications are also okay in pregnancy, so if you have any questions about that, speak with your epilepsy doctor right away. And lastly, barrier method can be used for everyone. I'm talking about condoms. But we also know that even when they are used to the best of your ability, they are not going to be 100% effective. So for that reason, having that open line of communication with your doctor, even before you start even thinking about having a child, is going to be super important. And if you're a woman of childbearing age with epilepsy, having sex of any kind, even with oral contraception, IUD, barrier, make sure you talk to your doctor about getting on high dose folic acid. It's the one thing that we know can help with neural tube malformations as it pertains to anti-seizure medications. I'm a believer that when it comes to chronic illness, women with chronic illness are going to be disproportionately affected, especially when it comes to decisions, as we have recently seen. Unfortunately, during times like this, when we feel out of control, the best thing we can do is take some control back. And that is to plan, especially if you're a woman of childbearing age and you have a chronic illness. Start talking to your doctor. If you have any specific questions about epilepsy or neurology in pregnancy, you can always shoot me a message. I'm happy to help within the restrictions of social media. I'm also happy to give names of other doctors I know who would be comfortable helping within your region. Epilepsy.com is also a great resource for people with epilepsy.